Hello everyone, welcome back to Learnings on 24 into 7. So here along with you, Miss Deepa, your clinical nurse educator. So in this session, we are going to discuss about HAI. What do you mean by HAI? HAI is healthcare associated infection, which is alternatively known as nosocomial infection, hospital acquired infection. But the ultimate term is uh, healthcare associated infection. So, hope you all are aware about the healthcare associated infections, as we all are actively taking part in the prevention and control of healthcare associated infection. So, just taking you to my screen. Hope it is visible for you. My screen is visible for all of you. See, so this here you can see one semicircle and another shape inside that. So this blue colored area is the hospital. Just assume this as a hospital. And the outside semicircle is the community. So here, see the infection I wrote outside. I mean, in the community is the community acquired infection. And inside this blue, I mean, the hospital is the hospital acquired infection or health care associated infection. See, outside infection within 3 days of admission. Patient is admitted in the hospital within 3 days. That means today itself, if I admitted today or tomorrow, if I'm developing any infection, from where I got the organism? From my community. So that is a community acquired infection. Okay. Now, infection after 3 days of admission, I wrote it inside the hospital. So infection after 3 days of admission, that organism I got from the hospital only. So that is a hospital acquired infection. Now, the infection within 3 days of discharge means the patient went out of the hospital to his home or her home back. But within 3 days, she is getting or he is getting infection means it is organism from where it came, hospital. So it's a healthcare associated infection. Now the infection after 3 days of discharge. After discharge, 3 days of discharge, the organism obviously again I got from the community. So it is community acquired infection. Hope you are not confused with the things. It is bit confusing, no? Like community and hospital. Very simple thing. We all know organism will be there inside our body for certain time. That is known as incubation period. For after that only we will develop with the signs and symptoms of the infection. So minimally we are considering it as 3 days. Just imagine. So from the community, I am getting infection means within 3 days I'll get the signs and symptoms. So that infection is from community. After 3 days, that is from hospital. Same for the discharge also. Hope it is okay. Shall we move on? So now I'm just telling you about the chain of infection. So for the infectious disease annual, we need to know the chain of infection, how the infection or the organism is getting transmitted. Then only we will be able to stop it. No, that I mean prevent it. So that is first of all reservoir. Reservoir is the place where the organism is embedded. Now the organism need to exit from the reservoir. So that is the portal of exit. Comes to the mode of transmission, how it is getting transmitted, and the portal of entry, how it is entering into a host, and the susceptible host. Susceptible means the person who is more prone to develop a disease. So I'll just give an example to you. One, just imagine I'm having a water tank in my home. No, so in that water tank, some organism is there, and so that is the reservoir for that organism. So from portal of exit, what will be the portal of exit? The tap from where I'm getting the water. The tap is the portal of exit. So through this tap, mode of transmission, what it will be? Waterborne disease. No, so waterborne, we all are consuming the water. So the portal of entry is my mouth. So it is coming, I mean, getting inside. I'm ingesting it. No, so susceptible host. Susceptible host means in my family, myself and all these members are consuming this water. But it's not mandatory to everybody should have developed the signs and symptoms, diarrhea or something. No, vomiting. Maybe old age people who is having less immunity, they'll be more prone to the disease. So they are the susceptible host. Okay, so that is the thing. For another example, if I'm COVID positive, I am the reservoir. No, the portal of exit is the droplet and the expired and exhale layer. Everything will be act as a portal of exit. So it's nails or mouth, majorly the portal of exit. Now come to the mode of transmission. It is contact or airborne also bit. It's telling portal of entry, another person, it's entering through the same. Then susceptible host who is not wearing the mask, all these things, and that is prone to getting infection. So that hope the chain of infection is clear for you right now. Now to prevent infection, the only thing is we need to break this chain from here, reservoir. If I am a COVID positive patient, isolate. So that is one thing. It will be get prohibited. I mean, the organism cannot an organism can exit, but it cannot go to other areas. Now come here, portal of exit. It is exited from myself, even inside my room, even isolated. But cleaning and disinfection can prevent the mode of transmission. Then portal of entry, vaccination or precaution, mask, hand hygiene, all these things. Then susceptible host. For the host, we need to do the proper treatment. So this is the ways to prevent the chain of infection, prevent the infection, how to break the chain of infection. Now coming to most effective way to prevent all infection. Anybody can say that? Now, I think most of you in your mind or in your voice, you're telling that hand hygiene. Yes, of course, it is hand hygiene. Hand hygiene is the most effective way to prevent the infections. So, I hope you all know this person, Ignaz Semmelweis. He is the father of hand hygiene. And now just wait. You can see the two hands. In that black area, here some black areas are there. See, these are the most areas most frequently missed. Now you can see the gray areas. These are frequently, less frequently, but missed. White area never we are missing. When we are performing the hand hygiene, almost all the time we are covering it. So Mr. Taylor only find out this areas. Now come to the 5 moments of the hand hygiene. 5 moments and the steps. Most of you are confused with this. 5 moments are nothing but the moments means the timings or whenever we need to do or perform a hand hygiene. That is known as WHO 5 hand hygiene moments. Okay. So there are 2 before and 3 after. 2 before and 3 after. Total 5 moments. First one is before touching a patient. Whenever you are going to touch a patient, before touching the patient, you need to perform a thorough hand hygiene. Now, before performing any procedure, whether it is a clean or aseptic, whatever procedure you are going to perform, before performing the procedure, you need to clean your hands. Now comes the 3 after. One is after touching the patient. After touching the patient, you need to perform the hand hygiene. So, after touching the patient surrounding. Surrounding include side rails, or the monitor, patient monitor, or the IV stand, whatever it is. Now, after the exposure to body fluids, okay, blood or body fluids, whatever it is. So these are the 3 after. Before touching patient, before any procedure, after touching patient surroundings, and after any exposure to blood or body fluids. Now the steps of the hand hygiene. For the steps of the hand hygiene, most of the time, nowadays we are performing the alcohol hand rub. So first of all, hand hygiene, if we want to say it as an effective hand hygiene, we need to concentrate in 3 things. First of all, the amount of solution. Amount of solution, if you are seeing in the AHD, hand rub, it is written like most of the AHD, it is 2 puff. 2 puff means 1 puff will be 1.5 to 2 ml. So total you are taking 3 to 4 ml, 3 ml basically. Okay. So that is the amount. If you are just taking a puff, it won't be effective to cover all your hand. See. Now secondly, the time. Time means it is 30 to 40 seconds, minimum 30 seconds. So every step we are performing 5 times. No. So second is the time. Third one is the friction. Friction means the force. Forcefully we need to. Some people are very lethargic, lazy. It won't be effective. So friction. So the 3 things are amount of hand rub, time, and friction. These 3 things, if you're performing effectively, then your hands are sanitized properly. Now come to the steps. You are taking 2 puff of the solution. So once solution is in your hand, usually what we all are doing, before that you need to remove all these things, okay? All these jewelries. Now, what you will do, we will just do like this. So all the solution will fall down. So what you need to do, just take it, just apply it. Now start the procedure. Palm to palm, 5 times. Okay? Right palm over, left dorsum. 5 times and vice versa. Now interlacing. Interlacing, usually people are doing like this, like a pyramid. No, it's not like this. You need to touch it, this area, then interlace. Now do it like this for 5 times. Now interlocking. Now here you are locking your hand, interlocking. And where you are cleaning, some people are doing like this. This is also knuckles, this is also. See this one, January, February, March, we did in our childhood days, no, for 30 and 31 days in the month. So the same area. So here you need to clean. So while cleaning this area also will get cleaned. So this is, okay. So this is 1, 2, 3, 4, 5. Vice versa for the other hand. Now the thumb rotation. Thumb rotation usually people doing like this. So while doing like this, with this thumb, just do like this. It is more effective. This area also will be covering properly and vice versa. Now the fingertips clockwise and anti-clockwise for the both hands. Now you can tell your hand is effectively sanitized or effectively disinfected. Okay, so that is about the hand hygiene. Just I'm requesting you to perform hand hygiene steps once very thoroughly. See what is the thing means. We all knows the steps, but while performing, we are getting a bit confused. What is the problem? Why we are getting confused? Because it's not a habit. If we are having habit, we will never forget it. For example, if you're brushing, we are brushing, no? I'm just asking you. You just think in your mind, which side you are performing first. Can you just tell it in your mind without thinking? No, because it's a habit. Automatically in the morning, even if in half sleep, we are taking the brush and paste, automatically it will go to that side only. This is my side. I don't know which is yours. Okay. So that is the habit. So if you're making it a habitual thing, for habitual, making the things habitual or behavior changing, what we need to do? We need to do it multiple times. No? Then automatically when you are taking the sanitizer, hand will move like this only. It will become a part of your behavior. So just try to make it as a part of your behavior. Anyhow, it's not a harmful thing, no? Okay. Now another concept. Ant. Who is ant? You all have ant in your home, no? It's not that ant. So this ant is ANTT, which is aseptic non-touch technique. It's a very simple concept. Okay. So there are surgical entity, standard entity, like that things are there. You just think about standard entity. Standard entity means entity is aseptic non-touch technique. Already I told you. Nothing. It is simply if I'm showing you one syringe. Okay. In this syringe, are we supposed to touch this area? No. So this is a key part. Any equipment, any thing is known as part. So this is a key part. We are not supposed to touch in the key part. We are supposed to touch here only and this two side only. No. So this is a key. Inside this is a barrel is a key part. Now, if I'm removing this, are we supposed to touch this needle? No. It's a key part. Okay. And if I'm removing this needle, and are we supposed to touch here? No, we are not supposed to touch. So this is a key part. And another thing is key site. What do you mean by key site? If somebody is putting a cannula here, usually we will sanitize this area, no? So after sanitizing, before inserting the cannula, just we will touch it. That means we are contaminating. So once it is cleaned, then this is a key site. In our body part, any cleaned area is a site. So it is a key site. So you are not supposed to touch any key part in the equipment or any key site in the body. That is the only concept in ANTT. So if we are performing ANTT, we don't want to, even nowadays, IV cannulation is not like we are not performing with the sterile gloves, but we are performing ANTT there. No, so that is the things. If we are performing it properly, we can do the procedure aseptically. So key sites and key part, the two concepts already I explained you. Now you can see some images. Now just with another click, you can see some into mark. Okay, red marks. So that means the key site and key part. See, these are the areas where you are not supposed to touch. These all are the key part of these equipments. Now, another important thing which we all are aware very thoroughly after the, after this epidemic, a pandemic, COVID, no? So PPE, gloves, mask, gown, cap, shoe cover, and the goggles. So I think you all are clear about the donning as well as doffing. What do you mean by donning? Donning means the wearing, sequence of wearing and removal. Okay, doffing is the removal. Now we are coming to our core area. So till now we will discuss about hand hygiene, PPE, ANDT. These all are to prevent this HAI only. Now what is HAI? Majorly in India, we are tracing these four HAI, the device related HAI. So CLUBC, COTI, VAP and SSI. So what is the CLUBC? CLUBC is a central line associated bloodstream infection. COTI, catheter associated urinary tract infection. VAP, ventilator associated pneumonia. SSI is the surgical site infection. So these are the major four type of HAI which is developed inside the hospital. Now, care bundle. What do you mean by a care bundle? What can be a care bundle? Care bundle, see, bundle. I hope you all are loving stories, no? So you might hear the story about one day monster took the princess to a castle and he put her in that castle. So he placed 7 doors outside this castle. Okay, so the prince came and he thought after if he cross one door he can save the princess. So the this monster was very wise, so he keep 7 doors. So it was very difficult for the prince to cross these 7 doors and finally save them. Finally he did it, but anyhow, so same like this, to save the patient is inside the castle and the 7 doors, just these are the different evidence-based practices. So the bacteria cannot go inside to the patient by crossing all these evidence-based practices. That is simply the concept of care bundle. Another example, see, you can see a paper. I can easily tear it off. So this is like you are performing a simple hand hygiene or something for all the procedure. So bacteria can easily go to the patient by tearing or by crossing that particular barrier. But here you can see a book. This book is also having a lot of papers, but I cannot tear it. Why? Because it is strong. So this is a bundle of paper. So same like that, we are performing a set of evidence-based practices to prevent the entry of the organism into the patient. So that is the care bundle, nothing else. It is nothing very Himalayan task or anything. We are just performing a bundle of things to prevent the HAI. First, we are discussing about the CLUBC. CLUBC is the central line associated bloodstream infection. So whenever central line we are inserting, we need to take care of certain things. And whenever we are taking care of or accessing our central line, we need to take care of certain things. So during insertion, what are the things we need to do? We need to concentrate. First of all, operator and the patient should be full sterile barrier precautions. Mine means if I am a patient, you are putting a central line here or anywhere, just placing a slit towel is not enough. I need to wear a mask. I need to properly put I am full body of myself should be covered. And the operator, the person who is inserting, also should be in full PPE. Okay. Now, chlorhexidine as a skin disinfectant. Usually the CDC recommended skin disinfectant is chlorhexidine, but different hospital based on the doctors, the consultant priority, betadine is also using, but chlorhexidine is the recommended thing. 2% and above chlorhexidine is used to clean the skin before insertion. Now, avoiding use of femoral site. Femoral, you see, central line is a catheter which we are inserting into a central vein. Usually the central veins are, which all are they? One is the jugular, another one is the subclavian, another one is the femoral. So femoral is mostly avoiding. Why? Because it is chance of getting contaminated is very much high. And jugular also. Jugular, for example, just I'm telling you one central line, if I'm inserting like this, so here there is a pulling force will be there. No, so that's why jugular is also most preferred is subclavian, but jugular is also people are accessing, but femoral should be avoided. Removing unnecessary catheters as soon as possible. Okay, so every day we need to assess the need, why it is need is it is there mandatory or not. So if it is not, immediately we need to remove. All ports are capped when not in use. Okay, the air can be get inside. If nowadays ports are not coming, it is valvular thing are coming, so this clamp you need to make sure, and you to cover. Usually we used to cover it in a sterile thing, and we used to keep it. Then single lumen catheter is used unless multiple ports are essential for the management of the patient. See, catheters are different: single lumen, double lumen, triple lumen, quadruple lumen, different catheters. So it's not a status symbol, no? While inserting, I'll put a maximum number of lumen. See, a single lumen can introduce 7 to 10% of infection. So double lumen means it will be 40 to 20, like that. Number of lumens are increasing, chance of infection is also increasing. So as per your requirement, as per your need, you need to restrict the number of lumen. Now, once it is inserted, we will suture it and we will dress it. No, dressing only. I'll go through the sequence only. Maintenance only dedicated lumen of a multi-lumen catheter should be used for TPN. TPN is a total parenteral nutrition. We all know total parenteral nutrition, glucose and food items are there. So bacterial growth can be maximal. So one dedicated lumen should be that. That lumen we should not be accessed for any other purpose. Now, I told you suturing and dressing. Dressing, sterile gauze is used. Usually gauze bandages are not using nowadays. Transparent dressing are used. But in case, if it is a gauze, it should be changed every day, 24 hours. If it is contaminated early, you need to change early. If it is transparent, 7 day, till 7 day we can keep it. If it is not soiled. If soiled, immediately need to change. Okay. And whatever, irrespective of the type of dressing, date and time should be of insertion should be there on the dressing. Daily inspection. We need to check the site daily for the integrity or any type of swelling, oozing, any kind of things. Now, while accessing means you are going to access the line to give something. That is accession. You need to remember majorly these things. I'll explain it. One is scrub the hub. Second is SAS. SAS means saline flush. Administration of the drug. Again, saline flush. Then push-post technique or positive flush. Now, I'll just show you these things. Just imagine I'm going to access a central line. Okay, this is a line attached to somewhere. So I'm just going to access this lumen of the central line. So first of all, alcohol swabs are available, no? So first of all, before accessing, I have to take an access alcohol swab and I have to do the scrub the hub. Scrub the hub is with the alcohol swab, thoroughly I am scrubbing it. Okay, for minimum 15 seconds. So 1, 1000, 2, 1000, 3, 1000, 4, 1000, 5, 1000, 6, 1000, 7, 1000, 8, 1000, 9, 1000, 10, 1000, 11, 1000, 12, 1000, 13, 1000, 14, 1000, 15, 1000. Scrub the hub. Now discard it. Now we will flush it. SAS. Second point. Saline flush. Then administration. Usually 5 ml flush we will administer. So attach it. ANTT you should remember. Unclamp. Slowly you are pulling and you are administering the flush. Okay. Now you are again clamping it. And you will remove this and you will administer your drug. I'm taking it, all will be in a sterile tray. I'm taking the drug. I'm administering my drug. Okay. Again, I'm clamping it. Remove drug butterfly or whatever it is you administered. Again, you need to SAS, last test, saline flush. So attaching, unclamping. Now see, I am not sure you can see. Yeah, 5 ml. So first 1 ml. Push, pause technique I told you. Push, then stop, pause. Now another 1 ml push, pause. Push, pause. Push, pause. Push, pause. So 4 ml administered and remaining 1 ml is here inside the syringe. So I'm keeping this 1 ml there. I'm clamping it and I'm removing it. Okay. So 1 ml was there. I'll tell you why it is. Again, new alcohol swab. Again, I need to do scrub the hub for 15 seconds. 1, 1000. You need to count it like that for 15 seconds. Now I need to cover it and I need to keep it. Okay. Now, why should I tell you push-pause technique? Push-pause technique. Push-pause technique means, why I'm using the push-pause technique? See, just imagine this is a central line. This is a line. Okay. So simple flush we are giving. First flush we administered like this. It will go like a straight line. No, it will go like stream only. So first flush we can give like anything like that. Now come to push-pose technique. What will happen if you are performing a push-pose technique? So this is the central line. This is the lumen, inside the lumen. So if I'm giving the flesh like this, the flesh will go like this, oscillatory. I can draw it like this only, but when it will go now, it will cover all the side of the lumen. That is push-pose, push-pose. Otherwise, it is also known as turbulent flesh or pulsatile flesh. It is go as a pulse. Okay, so these three names are there: push-pose technique, pulsatile flesh, or turbulent flesh. So this is the last flesh. SAS, we learned SAS, saline flesh, then administration of the medicine or whatever it is, and the last saline flesh should be given based on the turbulent, push-pose technique. Clear? I hope it is clear for you. Now I kept a last 1 ml here. Why it is like that? Even you are seeing that we are inserting the cannula and we are flushing after insertion. Still we are seeing a blood tinged fluid inside the cannula, no? So why? Because when we are fully pressed, negative pressure will be inside. So in this negative pressure and in the central line or wherever it is, positive pressure is there. So backflow will be there. So if you are keeping 1 ml there, here also it is positive and inside also positive. So no backflow. So that is the benefit of keeping 1 ml inside that. That is known as positive flush. So hope this concept is clear for you. Now again, back to the screen. So that now hope it is clear. Scrub the hub, SAS and push-pose technique and the positive flush. Now comes to the CAUTI. CAUTI is catheter-associated urinary tract infection. So first point is aseptic technique. We need to, whenever we are inserting the catheter, we need to follow the aseptic technique. Single patient use lubricant jelly is used for catheter insertion. For a single patient, single jelly. We cannot use a single jelly for multiple patients. Now, urethral meatus is cleaned with betadine before the insertion of the catheter. Means, usually perineal care, if the patient is bedridden, we used to give a perineal care thoroughly. And just before the insertion, we need to perform a perineal care again with the betadine solution. Okay, like how we are performing the perineal care, same like we need to perform again just before inserting the catheter. Now, indwelling catheter is connected to sterile closed drainage system. Usually, we used to just imagine, I don't have a Foley's catheter, just imagine this is a catheter and this is the, lumen. Okay, so usually what we wish to do, we will keep it in a kidney tray and when urine flows, then only we will connect with this. Previous practice was like this, but now, previously we need to connect it with the, urinary bag, that drainage system, and it should be a closed drainage system. Then we will never open it. We will insert the catheter and we will keep that closed drainage system intact only. Now, catheter specimen of urine only taken when clinically indicated. Whenever indicated, then only catheter, specimen will be taken from the catheter. Urinary drainage bag should be positioned below the level of bladder. That we all know gravity is there, no? So position below the gravity and instruct the patient also whenever patient is even walking patient or something. It should be, urinary bag should be below the bladder. And one more thing is there, whenever we are inserting the catheter, we should fix it on the anterior thigh. Anterior thigh, we need to fix it. Otherwise, this pulling force, urine bag is full of urine, pulling force will be injuring the area and it can lead to infection. Then emptying of the bag. Whenever it is 3/4 full, immediately we need to empty it. Catheter and the collecting tube is free from kinking. If any kinking is there, urine will not flow frequently or as in that flow. So the stagnant urine, so many nitrogen, BUN, so many ammonia, so many things are there. So bacteria will grow very fast in that stagnant urine. So secure catheter to legs, already I told you, and catheter or drainage bags are changed whenever clinically indicated only. Any sign of infection, pus collection, in such kind of cases only catheter or drainage bag. Catheter, it is not mandatory change after 14 days or something. Nowadays, as per the CDC policy, we can use it so long we are required, until and unless there is no signs of infection. So that is all about the catheter associated urinary tract infection, and always maintain it as a closed drainage system. For the sample collection and all, you don't want to remove it, you can say just insert the needle and the side of the catheter. If it is a catheter, here you can puncture and you can get a sample if it is. That's why I told you, whenever clinically indicated, then only we are supposed to collect the sample. Now come to the ventilator associated pneumonia. Ventilator associated pneumonia usually happen for a patient who is on ventilator and we are not taking care of proper oral hygiene or suctioning, these kind of things. After 3 days or something, patient is developing VAP. Even VAE, ventilator, if it is not a pneumonia, we are considering even VAE, ventilator associated event. So what are the things we need to take care? First of all, elevation of the head of the bed. The angle we are telling is 30 to 45 degrees Celsius elevated it should be. Now, oral care every second hourly. Some hospital is having policy of fourth hourly, so whatever is yours, you can follow it. But it is mandatory performing with chlorhexidine as per the CDC guidelines. See, chlorhexidine, it is not the one which you are using to clean the skin or alcohol hand rub which is containing chlorhexidine, nothing. It oral specific, it is coming specifically it is coming for oral care. So that solution you need to take, and you need to do the oral care every second hourly, because we all know why we are doing brushing in the morning, because in the all the night we are not swallowing or anything, so organisms will be there, foul smelling will be there. So this patient is now not at all having even not saliva, we are having at least saliva. So this unconscious patient cannot swallow saliva also, so their oral cavity will be contaminated. So if we didn't perform it frequently, bacteria can go inside. So that's why. Now, peptic ulcer prophylaxis within 24 hours of start of mechanical ventilation. Peptic ulcer prophylaxis, why it is? Because patient is not taking anything orally, so acidity will be there. If acidity is there, we are having one thing, gag, no? So gag, unconscious, तो gag नहीं होगा, but in case acidity is more, chances of aspirations are there. So any aspiration, any kind of such reflux can cause infection. Deep vein thrombosis prophylaxis. DVT is a common thing. As the patient is not at all moving and lying down, DVT, deep vein thrombosis can happen. DVT, you know, it is in that, in the leg, calf muscle, which is calf muscle is moving, muscle relax, that movement, that only making the vein to push the blood up. No, the valves are moving. So when the valve are moving, it is upward, unique direction. When the valve is not functioning properly, inside the side of the valve, blood clots are there. That clot will further moving and it is delodged to circulatory system. Then it will land up in the pulmonary vein and pulmonary embolism. So pulmonary deep vein thrombosis prophylaxis measures also need to be started. Subglottic suctioning. What do you mean by subglottic suctioning? ET tube or means it will be there to tube suctioning. If the patient is connected with the tracheostomy suctioning should be done. And whenever we are doing even oral suctioning, we need to do a subglottic suctioning through proper inside. We need to do the suctioning, because otherwise chances are there aspiration or this even cuff pressure also we are monitoring. No, that ET tube cuff pressure. Why we are monitoring? Cuff is not having proper pressure, through the side minimal secretions will be going. So that's why suctioning is important. So the frequency as per your hospital policy, second hourly or whenever it is necessary, please do the oral suction, which is subglottic suction. Sedation vacation. Sedation vacation means the patients which is who are on ventilator will be on sedation. So we need to reduce the sedation so that we can assess that whether patient is having any awakened. So patient is awakened, then only patient will try to take breath by themselves. So if we are came to know this at the earliest, we can start the weaning process also. So this is the major thing. One more thing, during weaning, when we are weaning the patient from the ventilator or we are extubating the patient, thorough suctioning is mandatory, because the secretions which all are there when we are, just taking the air out of the cuff, immediately all will get aspirated, and that can also land up in an infection or complication. So that is also another important point. So hope you are clear with the points to prevent the ventilator. Majorly head elevated, peptic ulcer prophylaxis, DVT prophylaxis, oral care, and the suction. Finally, sedation vacation. Coming to SSI, surgical site infection. Surgical site infection, there are so many types. I'm not going into detail, just if you want to know how to prevent it. So surgical site infection, like happening immediately after surgery, maybe after a year of the surgery also, for the implants and all, no? So there are different levels of primary, secondary levels are also there. And based on the area, like infection just is skin or just on the suture, or when it is going invaded or deeply, or when it affect other things. So different classifications are there. So for preventing the surgical site infection as a nurse, pre-operatively, intraoperatively, or postoperatively, what we need to do. That's only I'm discussing here. So first one is surgical clipping. So surgical, previously shaving was performed. Nowadays shavings are not allowed because shaving can create so many erosions in your skin, so that can lead to an infection even later. So surgical clipping is nowadays it is performing surgical clipping only. And another thing is antibiotic prophylaxis. So we all know antibiotic is administering that first one prophylactic dose of antibiotic is administering for all the patients who are there for surgery within 60 minutes of the skin opening. So when the skin is opening within, 60 minutes, within the 60 minutes, we need to administer the antibiotic. So if there is a long delay in the OT or something, you can just give the test dose and you can send the antibiotic along with the patient to the OT. So it is mandatory that it should be administered within 60 minutes of this incision. The patient's temperature maintained within 30 to 36 degree throughout the surgery. In surgery, during surgery, we all are know hyperthermia, feverish patient, we will never operate. We will maintain the temperature of the patient. Otherwise, it can also cause to infection. All diabetic patients, blood sugar to be maintained. Like sugar, glucose, we all know bacteria all like sugar, no glucose. So if blood sugar is high, chances of infection, post-operative infection is at high. So always we are performing the surgery once the patient's blood sugar is less than 180 milligram per deciliter. So that's all about it. So any query is there, you can contact me. I hope you all are having my contact details or number 8860-846468. Okay, so you can call or you can email, and any further topics we can discuss. So hope this is clear. Just a brief session about healthcare associated infection. What is healthcare associated infection? Major prevention aspect, and further to the healthcare associated infection prevention bundles, which is CLABSI, COTI, VAP, and SSI. Hope it is clear for you. All the best. See you soon. Bye-bye.